Hello, this is Dr. Prajnanika, focused on your fertility health. And today, we are going to talk about menstruation and the important things you need to know about it. For something that is an integral part for better half of a woman's life, we women are surprisingly very unwilling to talk about menstruation and many a times ignorant about many facts. I feel that there is a lack of knowledge as well as there are many myths and misconceptions associated with the menstrual cycle. Another thing which may lead to unwillingness to talk is the stigmatization of the symptoms. If a girl has a menstrual cycle, she is taught not to talk about it. She should restrict her activity. Earlier, there was a concept that women are impure during these periods. So all these things leads to stigmatization of a very normal physiological phenomena. Menstruation is not a disease. It is a normal physiological phenomenon. And if you want to have a good reproductive health, it is important that you know things related to menstruation. When do we say that you're having a heavy flow? So if your menstruation lasts for more than 8 days or you are having more than 80 ml per flow, so that is you're soaking a lot of pads, or if you're passing big clots, that means you're having a heavy flow. Now when you're having a heavy blood flow, your body may not be replacing the red blood cells. So you are losing a lot of blood. And so this might lead to iron deficiency anemia, and this can lead to a feeling of tiredness or chronic fatigue. Another interesting thing is that if you're anemic, then again you might have heavy flow. So it's sort of a vicious cycle. Heavy flow is causing lack of blood, and lack of blood is again causing heavy flow. Another thing you should note is many a times if you're having heavy menstrual flow along with chronic fatigue, it may be a symptom of a disease known as endometriosis. Endometriosis is a chronic inflammatory condition in which the inner lining of the uterus is growing outside. And in these cases also you have tiredness along with heavy flow. Perception of what constitutes a heavy flow varies from woman to woman. If the flow is affecting your quality of life, then definitely it must be abnormal. Heavy flow generally is defined if the duration is more than 8 days or more, or passing lots of clots. So if you're having a heavy flow, then you should contact your doctor, because if you have persistently heavy flow, it may be due to some underlying disease such as fibroids or some blood abnormalities, which if undetected can lead to certain problems later on. And another thing is, due to heavy flow, you're losing a lot of blood and lot of nutrients, and this can lead to anemia or other nutritional deficiencies. To know what are early periods, let's first see what is the normal duration of a menstrual cycle. So generally it is about 28 days and it can vary from 24 to 35 days. So if you are having menstrual cycle before 24 days, this constitutes to be an early period. Now if you are having periods between 24 to 28 days of your cycle, then this does not constitute an early period. Early period can be due to various reasons, but main underlying condition is an hormonal imbalance. Many a times it can be transient, stress, anxiety or various other factors can lead to early periods, and you should not be worried about it. However, if you are persistently having early periods or short cycles, there may be various conditions for which you need to show to a doctor. So one condition is if you are having a decreased ovarian reserve, or if your eggs are decreasing, then you can have early periods. And usually women above 35 years old, they slowly start having short duration of cycles, and this is due to hormonal fluctuations. And sometimes even women with polycystic ovarian syndrome can have early periods instead of having delayed periods. Generally, we tell to keep a menstrual calendar to note when your cycles are coming. And if you see that you're having short cycles every month, then you should visit a doctor and get checked up for the underlying conditions. If it is transient on and off, then you needn't worry about it. No, you cannot get pregnant during your periods, and there are two main reasons for it. First, the eggs are not ready to be fertilized. And second, the uterus is not ready to receive the fertilized egg. But if one gets pregnant, one can have periods for the first 3 months, which is usually less, the flow is less than the normal flow, and pregnancy might remain undetected. And so you might think that you have conceived during your periods. Another condition is when the pregnancy does not occur in the uterus, but it occurs in the tube, or ectopic pregnancy. And during that also you can have periods. But you have to remember that the pregnancy was conceived before the periods, and the periods continued. So ignore the myths and the rumors. The bottom line is that if you are menstruating during that time, you cannot get pregnant. No, PMS is not in a woman's mind, and you should not even say that to a woman. Everyone has those hormonal changes, but some are more sensitive to the hormonal changes occurring towards the end of the cycle. Usually before you get your period, starting maybe about 7 to 10 days before your expected cycles, like you might feel bloated up, you may experience mood swings, you can be more irritable, you might feel more anxious or not happy at all. And many women also have these acne eruptions. All these are due to the hormonal effects, and there is usually a fall of the estrogen and the progesterone hormones just before the menstrual cycle, due to which these symptoms are occurring. And these are coined as premenstrual symptoms. So PMS is a real phenomena. It is not only in the mind. And you have to understand that a woman's body undergoes these changes every month, and she has to face these things every month. So whenever you're saying to a woman that you're PMSing, think twice. So instead of belittling her problems, you can be at least supportive towards her. Support and care goes a long way to decrease the symptoms of PMS. The more we talk about the texture and color of periods, you can see the unwarranted anxiety among the women. So generally the period color will vary from cycle to cycle. The texture will also vary from cycle to cycle, and it will also vary from the time when you started, maybe as you age and before your periods are going to stop. There are certain things that if you're passing lots of clots, then this is abnormal. Another thing that is, if you're having persistently very less flow and if it is very blackish in color, you might be having a problem in your uterus. The lining can also happen if you're having the TB of the uterus. So barring these conditions, color and texture needn't be worried about much. Periods में तो pain होता ही है. So let us see what are these period pains or menstrual cramps. So whenever you are menstruating, the uterus is contracting, and this is manifesting as cramps or period cramps. So usually it starts with your periods, and it is maximum generally on the first day of your periods, and as your period progresses, the pain decreases with the decreasing flow. But all period pains are not normal. If your period pain, you're dependent on medicines, have to get admitted for a periods pain. If it is starting before your periods, then these period pains are not normal. So the normalization of the menstrual cramps or the periods pain has often led to women not coming to the doctors when they're having severe symptoms. Many a times they are not willing to talk because they feel that they will not be given importance, or they will be said that it is in their head. But it is very important that you know these things and get checked up if you are having severe pains. During menstruation, a woman might not be uncomfortable only due to the flow or due to menstrual cramps. There may be various other things, such as she might be having pain while passing urine, or she might be having pain while passing stools, or pain during defecation, known as dysphagia. Now this usually occurs because she might have an underlying condition known as endometriosis. Or another condition is that you feel like passing stools and you will have pain like that, but you're not able to pass stools. All these conditions should raise a suspicion of pelvic endometriosis. To know more about endometriosis, please check out our videos on YouTube and Instagram. Bleeding in between your periods is usually abnormal, but sometimes it can be normal. So first let us see when it's normal. If you're having a mid-cycle spotting, that is usually related to ovulation or release of eggs, you can also have slight pain during that time. That is usually normal. So if you're having intermittent bleeding in between your periods, it usually raises the suspicion of some pathology in your reproductive organs. So there can be some tumors such as polyps, or there can be infection of the cervix such as cervical erosion, due to which you might be having spotting. Importantly, it can also be a symptom of cancer, and so you should get checked up and get a physical examination by a gynecologist, do a pap smear, and also do an ultrasound to check whether there is any problem in your uterus due to which you're having this intermittent flow. Another reason for intermittent bleed is hormonal imbalances, and due to hormonal imbalances, if you're having this, you might also be having difficulty in conception. And lastly, it might also be iatrogenic. Whenever a patient comes with intermittent bleeding during your periods, we do ask, are you on any pill therapy or are you on any hormonal medications? Because if you stop those medications in between, you will have irregular bleeding in between your cycles. Usually the uterus becomes smaller when your periods stop, and the lining of the uterus or the endometrium becomes very thin. Another reason they can be, which is very important, is that there might be some precancerous or cancerous lesions due to which you're having menopausal bleeding. Whenever you're having bleeding after menopause, you should visit your doctor, get an ultrasound done, and also get a checkup done to rule out cancer. Fertility and menstruation are interlinked, because why menstruation is happening and why one is not getting fertile, the underlying, you can say, the basic physiology is the same. So every month the egg is ovulating, the egg is secreting certain hormones, the estrogen hormone, making the inner lining of the uterus grow. And if the egg is not fertilized, then this estrogen hormone drops, and then you're having endometrial shedding in form of menstruation. So you can say that menstruation indicates that the fertilized egg has not implanted in the uterus, and so the lining which was made to receive the embryo is shed off by the uterus. So this also we see in the patients that they are coming to us, they say that the menstrual cycles are irregular and that's why they are not getting fertile. So yes, irregularity of menstrual cycle may be an indication of an underlying pathology which is again causing infertility or subfertility. This is Dr. Prajnanika, focused on your fertility health. For more such content, please like and subscribe to the channel.